Good morning. I am Stefano COACCIOLI, an associate professor of internal medicine at Perugia University School of Medicine, and I am head-in-chief of a Department of Internal Medicine, Rheumatology and Pain Medicine. Today my interest and my presentation concerns a new way to consider inflammation and pain, the relationships from inflammation and pain. In other words, nowadays there is a new side in inflammation, because the first step of inflammation begins from inflammasome. Inflammasome is a complex network of protein, molecule and enzymes that activated each other, and this leads to an activation of inflammation itself. There is another situation called autoinflammation that is characterized by many clinical situations. Both inflammasome and autoinflammation, together with the autoimmune mechanisms, led to an inflammation, and inflammation provokes pain. Provokes pain by the activation and the relationship with the nociceptor, for example, in rheumatology, in the articular joint. And there are many tissues that have, and many tissues that have not nociceptors. The tissues that have nociceptors is, for example, the articular capsules, the subchondral bone, the tendons and the muscles. The tissues that have not nociceptor are cartilage, meniscus, intervertebral discus and synovial membrane. So that even if the mechanism is strictly concerning autoimmunity, like the synovitis in rheumatoid arthritis, even if the mechanism is the autoinflammatory, like in the gut, podagra and criragra, for example, with the precipitation of needle of urate monosodic, we realize an inflammation. In these cases, a wide inflammation, a deep inflammation, a great inflammation, instead of the light inflammation that characterized osteoarthritis, in which the first culprit is represented by interleukin-1 produced in the subchondral bone, then destroyed cartilage and led to the destruction of cartilage and the joint itself. Now we have many molecules to reduce pain, both in inflammatory situation, in autoinflammatory disease and in autoimmune disease. Not yet against inflammasome. For example, we have non-steroidal anti-inflammatory drugs, such as the traditional non-steroidal anti-inflammatory drugs, or the new molecules that has chimeric structures, an enantiomer, like the dexketoprofen. We have immunosuppressive agents, such as cyclosporin A, methotrexate, and cyclophosphamide, niacinamide, azathioprine, etc. We have the steroids at low dosage for a long therapy, at high dose for a short therapy. And we have the opioids, obviously, both at weak activity or strong activity. And finally, we have the biotechnologic molecules directed against both TNF-alpha and other cytokines. And this open a new way to consider both inflammation and the word of inflammation and the therapy for inflammation itself.